Okay, that's our Megan Fitzpatrick in Toronto. Now we're going to get the medical perspective on the Ontario government's move. Dr. Allison McGeer is an infectious disease physician and a senior clinician scientist at Sinai Health System. She is in Toronto. Dr. McGeer, it's good to talk to you again.
Nice to talk to you, David.
I wonder, do you agree with Ontario moving up the timetable for lifting some restrictions ahead of schedule?
Yeah, I think it's fine. Again, we need to be pushing the limits on this so that we're using the least public health restriction that, maintains our healthcare system and keeps the number of serious illnesses, deaths down. And they're absolutely correct that despite the fact that we've reopened schools, that we've released some restrictions, and taking into consideration all the uncertainties about the difficulties with modeling now, it really does look like things are not picking up. So to me, I might have preferred them to go a little more cautiously, but it is totally logical to be releasing things. I do have to say that what I heard from Premier Ford today was that he was planning to remove vaccine passports. So I am still hearing that we're going to wait and see what happens in the 2 weeks between now and March before we decide. And that's really good news, because I think we are learning in Ontario, I believe, that, you take one step, you watch to see what happens, you try not to go too quickly so that things don't get out of control again. I do think that all of us need to be braced for the fact that things might get worse again. We are seeing an increase in BA2, and BA2 is more transmissible than our first variant of Omicron. And it's a lot of restrictions that we're choosing to release now. So, there's no guarantee that we're not going to see a bump, and we might not have to walk back a little bit of it. But, that's that's the roller coaster we're on, right?
That's been life exactly for a couple of years.
You can go. Yep. And you want to go as far as you can, but not too far. But knowing what that is really hard.
Okay, so the vaccine passports, let's zero in on that for a second. Eliminated as of March 1st. Now, it's still optional. A restaurant, a bar, or wherever can still use it, though this comes with some enforcement issues and social cleavages if they choose to go that way. But when you look at the data, does it support this move? Because I know this is something that gives people comfort when they go out, right?
Yeah, I think that's the balance that's really hard to judge. It very clearly, from a reduction in transmission perspective, vaccine passports are not worth what they were worth in October and November, because 2 doses, even 3 doses against Omicron doesn't protect you nearly as well against relatively mild disease. So the transmission risk, despite passports, is significantly higher, and that means really the benefit in reducing transmission, the ability to say, okay, if you're vaccinated, you're much less likely to get disease, you're less likely to transmit, so it's safe to have fewer restrictions. That piece is no longer true. However, the piece of unvaccinated people are still at really substantial risk of serious illness and death from Omicron. So that piece of protecting them by, not permitting them in the highest risk circumstances would still be there. And that's the hard argument, right? We don't like to restrict people's freedoms, but we do. We make people wear seatbelts. We close winter roads when they're dangerous. We restrict people's activities in a variety of ways to protect them. And so we could choose to maintain vaccine passports to protect unvaccinated people. On the other hand, as we progressively release restrictions, it also makes sense to say, okay, we can, vaccine passports were one more level of public health intervention. And if we're getting rid of levels of public health intervention, it should be on the list to be reconsidered.
A question I have, I wonder, you heard the Premier there off the top. This isn't happening because of Windsor and Ottawa. It's happening in spite of it. But we're seeing just so much unrest and so much disruption and so much protest. I mean, as a doctor, as a scientist, how concerned are you that all of this can push public health policy maybe faster than it should be moving?
That's not how I'm hearing public health respond. I I do think, you do have to take into consideration, how people are feeling. And we all know how we're all feeling, right? At the same time, I think our governments recognize that, this is not about what we want. This is about dealing with the virus. And the virus runs on its own timetable. It does its own thing. And really, I think frustrating for the sense from the protesters that the government is in some way in charge of this, right? The government is not in charge of this. The virus is in charge of this. And none of this is optional. And so, yes, I do think there is pressure. On the other hand, it's fair that the government is hearing how upset people are, right? This is what they're there for, to be able to listen to how people are feeling and to then make the best decisions for the population at large. So I don't actually think, I do think it's hard to make the decision in either direction now because the protests are so loud. Right. If you say, okay, we're taking away mandates, then people will say, well, the protesters, got what they wanted because they were protesting, even if that's not true. On the other hand, if you keep them in place, people get angrier. So, there's an element of lose-lose in this for governments, I think.
No, Allison McGeer, you make a lot of good points, including the fact that the virus is really in charge here, and we're all just trying to deal with it as best we can. Look, we always appreciate your insight. Thank you so much for joining us tonight.
Take care. Bye-bye.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.